Hi everyone, welcome to another episode of Excela Health Virtual Mall Walkers, and happy March Mall Walkers Day. Since today is Mall Walkers Day, we have another featured physician presentation for you. Dr. Benfazi-Elatrash from Excela Health Surgical Specialists will be discussing the topic of gallbladder health, including the function of the gallbladder, as well as signs and symptoms of gallbladder issues, and how Excela Health offers innovative solutions to treat these issues. Let's welcome Dr. Benfazi-Elatrash.
Hello, my name is Dr. Benfazi-Elatrash, and I'm a general surgeon with Excela Health Surgical Specialists. A little bit about me: I actually grew up in the Mount Pleasant, Pennsylvania area. I come from a family of physicians. My dad was a family practitioner. My uncle Salim was a orthopedic surgeon in the area, and now my brother and sister give primary care services in Mount Pleasant, as well as wound care services in the area as well. What I'm here to talk to you about today is gallbladder issues. So many people don't necessarily know what the gallbladder is. I have a little picture here that we can refer to, but the gallbladder basically is something that is underneath the liver. And what the gallbladder does is it stores something called bile, which is a type of fluid that the liver itself makes to help us digest fats. So when the gallbladder fills with the bile, basically when you eat, the gallbladder gets an idea that it needs to contract, and it helps us digest foods. So that's basically the function of the gallbladder itself. Now, sometimes we have issues with the gallbladder, and that's in the form of gallstones. What gallstones are, most of the time, they're stones from cholesterol. And we don't know really why people get gallstones. There's some risk factors that can cause people to have gallstones, such as being older than 40, being overweight, during pregnancy, and actual weight loss itself, and even some people have a family history of gallstones, which can attribute to people getting gallstones themselves. Now, people can have gallstones and not have any symptoms, but some people actually do have symptoms. So what are those symptoms? Those symptoms include pain kind of in your stomach here on the right side, some nausea, some vomiting. Sometimes the pain goes to your shoulder or goes to your back, and that seems to cause a lot of discomfort. And most of the time, the pain gets exacerbated by eating fried or fatty foods, because that's the function of the gallbladder. When you eat fried or fatty foods, it gets a signal and says, I have to squeeze. It squeezes, and if you have gallstones, sometimes that can cause pain. So what do we do about the pain? And what do we do about issues with the gallbladder? Well, sometimes you just have pain from the gallstones, or other times you get an infection of the gallbladder. The best treatment for this is to remove the gallbladder. There are some other modalities that are not the best for this. Sometimes you can give medications or trying to break up the stones, but those haven't been shown to have any good long-term success. So the best treatment is to remove the gallbladder. Well, you ask how we do that. There's different ways to do that. The standard of care nowadays is to do it through small incisions, and we call that laparoscopy. Now, with even more technology, we do the same thing through small incisions, and we can do that robotically. The picture that you can see here shows the 4 incisions that we need to make to do it robotically. And those incisions are usually closed with absorbable suture and glue afterwards, so hopefully you have a nice cosmetic feel after everything heals. Basically what we do is when we go in there, we identify the gallbladder itself after we inflate your belly with air, and we identify the artery that supplies the gallbladder and this little duct that connects to the gallbladder. We kind of clip those and remove the gallbladder off the liver bed, and then take your gallbladder out. That's usually how it's done. It's usually an outpatient surgical procedure. It takes anywhere from an hour to hour and a half, depending on how inflamed the gallbladder can be. And people tend to go home the same day. Now it's a little different when you go to the hospital, and we do it in the hospital, because you may end up having an infection that needs antibiotics for a few days. But it depends on kind of where you see us, whether it's in the hospital or in the clinic. Now I like to do this robotically, and the reason why I like to do it robotically is the advantages of robotic surgery. Robotic surgery gives you 3D visualization. It gives some ergonomics, which means basically my wrists kind of move like this, and I could do the same thing with a robotic instrument. Now in the next picture, after you saw everything that's set up for the robot, you see something that's lit up green. We actually call that firefly. And what that is we inject some sort of contrast material that is something we can't see with the human eye, but the robot has the capability of viewing that, and allows us to see the structures there pretty easily. You could see the two pictures that are in comparison there. One of them shows that there's no green fluorescence. The other one shows that there is. Well, when we see that green fluorescence, it helps us identify the structure safely so that we can remove the gallbladder in a safe manner. Now, what should you expect after gallbladder removal surgery? Well, the hope is that your pain goes away, and eventually with time you'll be able to eat kind of the fried and fatty foods, even though we tend to try to have you avoid doing that. But within about a week or two, usually you can eat regular foods, and usually in about 6 weeks you feel relatively back to normal. But keep in mind, even though we did things through small incisions, it takes a little bit while to heal. So we need to allow your body at least 6 weeks before doing anything major, such as heavy lifting or strenuous exercise, so that you have a complete healing process and that you don't have any problems from the surgery itself. Now, what are the risks of having these procedures? The risks in general are low, but there's stuff that you should be aware of. Some pain at the incision sites is common. Is there always a risk for infection? Yes, but we give you antibiotics beforehand and we do everything in a sterile manner. The main thing would be damage to the other structures that are in the area. Now the other structures, as you could tell from the different pictures that we had showed you, the other structures would be kind of the stomach, or sometimes the ducts that connect to the gallbladder. Now luckily, with the use of the robot and use of Firefly, we can see those structures a little better to help us prevent causing injury. But even with laparoscopy, for how advanced the camera is, we can see those structures pretty clearly, and the risk of causing any injury to those structures is less than 1%. These are safe operations that we do, and it's the best treatment for any gallbladder issues. As far as what you do after the surgery, you come back and see us in the clinic. We make sure that you're doing okay, and if you need to see us again, we'll be happy to see you again. Otherwise, we send you on your merry way. I thank you for listening to this presentation today. I hope you learned something about gallbladder issues and signs and symptoms of gallbladder problems. Be happy to see you anytime if you have any problems, and everyone have a good day. Thank you.
We want to thank Dr. Ella Trash for taking some time to be with us today and educate us on the topic of gallbladder health. Nutrition is also an important component in keeping your gallbladder functioning properly. So, let's check in with Dawn DeVoli to see what meal she's making today on another segment of What's in Your Pantry.
Hello again, and welcome back to another episode of What's in Your Pantry. Today we're going to focus on keeping our gallbladder healthy with a feature recipe that is high in fiber, full of vegetables, and low in fat, especially saturated fat. The name of the recipe is Spring Vegetable Grain Bowl. Now, before we get started with the making of this super easy meatless dish, let's review the ingredients. So, to make our spring vegetable grain bowl, We are going to need 3 cups of cooked farro, 1.5 teaspoons of salt, 2 tablespoons of extra virgin olive oil, 1 tablespoon white wine vinegar, 1/2 cup of chopped arugula, 1/4 of a cup of sweet peas, 2 sliced baby carrots, 1 sliced green onion, 1 sliced celery stalk, 1 sliced small beet, 1/2 cup of crumbled goat cheese, and 1/4 of a cup of chopped parsley. Okay, so you will see how easy this grain bowl is to throw together, and to make it even easier, I have used 3 shortcuts, okay? So my first shortcut that I wanted to share with you is with the farro or the farro. I'm using this 90-second farro that you just cook in a microwave. Comes in a pouch, super easy. So we're gonna cook that up, and then you just fluff it up with your fork, and we're gonna add that to our bowl. Next, we're gonna season this with just a little bit of sea salt, and then we're gonna add the dressing, the olive oil and the white wine vinegar. Okay, if you don't have white wine vinegar, you could always substitute it with sherry vinegar. So we're just gonna mix this up a little bit. And now we're gonna start adding the spring vegetables. So first off, we're gonna add the chopped arugula. Then we're gonna add the spring peas. Now this is my second shortcut. I'm using frozen sweet peas that I just cooked in the microwave and I let cool. So add your sweet peas. Next, we're gonna add the carrots. Now, instead of using just orange baby carrots, I'm using rainbow carrots. They are yellow, orange, and purple, so we're gonna get some extra antioxidants there. Next comes the sliced green onion, the celery stalk. Next is my third and final shortcut with the beets. I did not roast a fresh beet. I am just using canned beets that I rinsed off and sliced up. We're gonna give this a good toss. You wanna mix up all the ingredients, make sure everything is coated with the dressing. Oops, lost a little carrot. All right, then we're gonna top this with the chopped parsley and then the crumbled goat cheese. You can see how this comes together so easily. This is the perfect meatless meal. Super colorful, chock full of spring vegetables, as you can see. Okay. So a serving of this grain bowl is about 1 cup, and all you're gonna do is just serve this in a bowl. Okay, you're gonna plate this up. The 1 cup serving has about 340 calories, has about 10 grams of protein, 10 grams of fiber, and there you have a meal, okay? So super easy to make. Using spring vegetables, don't feel like you always have to use fresh. You can see I took some shortcuts. I used frozen and canned vegetables. So the healthy habit tip of the day for today's episode is keep your gallbladder healthy by trying to do the following things, okay? Number 1, choose whole grains. Whole grains are an excellent source of fiber, and fiber helps keep our digestive system moving, flushing out bile, okay? Number 2, choose fruits and vegetables. Try to eat more fruits and vegetables, right? Eat more plants. Fruits and vegetables are excellent sources of vitamin C and vitamin E, both which have been shown to help prevent gallstones. And number 3, try to eat low fat. And the fats that we're choosing, try to use unsaturated fat, like our extra virgin olive oil. So That about wraps up this episode. I hope you'll give this recipe a try. You can see pretty much you get all your ingredients together, dump it in a bowl, and stir. So, as always, thank you for joining me. I hope you will stay tuned. And until next time, stay healthy, and we'll see you later. Bye-bye.
Welcome back, Mall Walkers. We hope you enjoyed today's cooking demonstration and our healthy habits tip of the day. Don't forget to check your email inbox for today's featured recipe, along with additional resources on how to maintain a healthy gallbladder. That's all we have for you today. Until next time, stay safe and stay healthy. We'll see you soon, Mall Walkers.